last year. There's an article by Kelo and Larson in the Journal of the AMA. Listen to what they had to say. On balance, the data remain imprecise, and the benefits that U.S. healthcare currently delivers may not outweigh the aggregate health harm that it imparts. Have you got that? They're saying we don't even know if we're breaking even in terms of damage versus benefit. Yeah, some stuff we do is life-saving. Some stuff we do takes lives. And we're not sure that the net is even positive. And get this, they're saying healthcare contributes only about 10% toward reducing premature death. Even a perfectly designed system would prevent only a modest proportion of premature death. Because, of course, they're talking about medical therapy. They're not talking about lifestyle changes. And Thomas Sass, a medical doctor, wrote a great paper called Beware of Pharmacracy. Isn't that a great term? People say, well, you know, what kind of government do we have in the United States? Republican, Democratic, bipartisan? Listen to this. We live in a pharmacracy, folks. In a pharmacracy, people are obsessed with medicine and perceive all manner of human problems as medical in nature and therefore amenable to medical remedies. If you really want to have a strange experience, there's a document known as DSM-4, which is the cookbook of diagnoses for psychiatric disorders. And I thought I was going to get kicked out of Borders when I was reading that thing. I was laughing so hard. I thought it was a parody. Then I realized it was the real thing. You know, things like, you know, spousal relationship disorder, math disorder, oppositional defiant disorder. I couldn't make this stuff up. So if there's a disease in search of a drug, the DSM-4 is happy to oblige. Which brings us to our brilliant folks in Washington. What are some of the nutty ideas they've come up with in response to the so-called healthcare crisis? First is my favorite, free drugs. They somehow think that if people don't have to pay for drugs and they're covered by the government, that will help to solve the problem. I mean, you know, it's the same thing they were talking about in the 60s when they were burning their bras and draft cards. They were saying, hey man, you got any free drugs? Yeah. That's what they want now. Indemnify drug makers so you can't sue them for their negligence when their products kill you. Isn't that a good solution? Cap damages to victims. Yes, penalize the victim. Subsidize malpractice insurance. All of this insanity is based on the faulty premise that if we simply do more of what's been shown not to work, but somehow shift the costs around in society, that will fix the problem. The problem isn't money. The problem is pharmacracy. And you might say, well, what in the world can we as chiropractors offer? Well, in the largest study I'm aware of involving 2,818 patients in 156 practices, they found that 95% reported that their expectations had been met, that 99% wished to continue care, that at least 5 years out there was seemingly no plateau on the reported benefits of chiropractic care, that people who had been under long-term chiropractic care tended to make better lifestyle choices, had fewer colds and flu, and on and on and on. Indeed, in a study of senior citizens over 75 years of age comparing chiropractic versus non-chiropractic patients in an insurance database, they found that the chiropractic patients reported better overall health, used fewer prescription drugs, were more active, and spent 21% less time in hospitals over the last 3 years. Can you imagine how spectacular those savings would be if applied to the general population of senior citizens? Even better is this study by Rupert of seniors over 65 years of age. See, that first study had been criticized because they said, well, there's a bias there. These are all self-selected individuals that chose on their own to go to chiropractors. These are healthier, more health-conscious individuals with less severe disease, and that's why it looks so good. Well, in the Rupert study, they took that to heart and they said, we're going to administer the SF-36, which is a quality of life inventory, to this population of chiropractic patients and compare it to the general population of seniors over 65. And they found there was no statistically significant difference, that their health status was about the same. But here's what they found when they had been under care for 5 years or longer. And by the way, they defined maintenance care in this study as just 4 visits a year or more. I mean, 4 visits a year or more and you were in. I mean, the bar was set that low. And even with the bar set that low, this population had 50% fewer medical provider visits. And you might say, do you mean to tell me they could cut medical care in half? The costs would be only half of what they are now? No, it's even better than that. That's the number of visits. The amount of money was only 31% of the national average. So not only were they seeing medical providers less, they were having less expensive stuff done. And 95.8% felt that their care was considerably or extremely valuable. Can you think of any profession that has that level of patient satisfaction? And what were we told by Dr. Slocum? Less than 3% of the population is under chiropractic care. They told me that I couldn't curse, but what the blank are we doing? In the People's Republic of Illinois, a managed care organization did something very bold. They said, we're going to let people go to the chiropractor first. We're going to allow our beneficiaries, or covered lives as they call them, to choose a chiropractor as their primary care provider. And the chiropractor can decide if they need to go somewhere else. Pretty bold move, isn't it? What happened? There was a 60.2% decrease in hospital admissions in that group, a 59% decrease in hospital days, a 62% decrease in outpatient surgeries, and my personal favorite, an 85% reduction in pharmaceutical costs. Yeah. So how do we make this dream real? At the top we have optimal health, however you define that. The World Health Organization defines it as complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Down here, we have the dirt nap. So, what happens between here and here? Well, we're subjected to various forms of physical, chemical, and emotional stress, which can be positive or negative in nature. Indeed, Selye differentiated between what he called eustress, which is the good stuff, the growing stuff, the thing that causes people to go to movies that will make them cry, eat red hot chili that burns inside as well as out, jump out of airplanes with parachutes, things of this nature, positive growing experiences. Most people talk about stress, though, only in the context of the negative. But the beautiful thing that you can do, if your nervous system is working correctly, is that by changing your attitude, you can transmute a negative, destructive experience into a positive, growing one. Indeed, you can actually transmute distress into eustress. This thing we call vertebral subluxation occurs here, which leads to asymptomatic pathology, which leads to symptomatic pathology, which leads to death. And if we compare chiropractic and its approach to wellness to medicine, it becomes very clear. In the allopathic model, the goal is prevention and early detection of disease. It's all about disease. Why should you get your blood pressure checked? So you don't have a heart attack or stroke and die. Why should you get a mammogram? So you don't get breast cancer and die. Why should you get your prostate poked? So you don't have cancer and die. Yeah. We're saying, no, that's not our goal. Our goal is not merely to avert disaster. Our goal is to maximize the expression of innate potential. We use active empowerment strategies, not passive fear-based strategies. The doctor is a partner or coach in a lifetime process, not a dominant maternalistic or paternalistic individual who gives doctor's orders as a series of events or episodes based on normal values. Indeed, our objective is to free people to realize the goals that they set for themselves. A completely different model.